Well, it started about 3 or 4 years ago in my clinical practice. Me and my partner, I was then in Greenville, South Carolina. We were realizing that more and more of our patients were purchasing wearable devices, either watches, smartwatches, or devices that could enable them to record their own electrocardiogram through that device. The Apple Watch came out with that technology, and a company called AliveCor with a device called Cardia were sort of leaders in the field. And what we were seeing is more and more of our patients, and me being a cardiologist and specifically electrophysiologist that treats heart rhythm disorders, we were seeing a lot of our patients adopting this technology. And the problem that we are realizing is that they really didn't have an avenue to transmit that information that is on their smartphones and smartwatches to their physician practices. They didn't have a easy way of getting that information to us in the office. They would either bring it in to the office on their phones, which obviously is not a time, sort of an efficient use of time. They would have to wait till they saw us in the office to give us that information, or they would try to transmit it through email, or they would try to transmit it through the electronic medical record, all of which is fairly cumbersome, and some of which had some sort of privacy concerns. So us as physicians in practice, we're struggling with what to do with these patients with this new technology. And we were realizing the technology was very useful, meaning that our patients were recording actual arrhythmias, and they needed some way of getting that addressed in a more efficient way. Out of this problem that we saw in clinical practice, we and my partner said, well, why can't we figure out a solution to this that allows our patients and in general consumers to transmit this information to the healthcare system? And we thought, well, why can't we as the clinicians help design something that allows this to happen? And we felt that the most sort of plausible or easy way of doing this is through an app-based software system. And so we engaged a company called CrowdHub, who helped us develop an application and that allows consumers, consumers, to transmit their wearable device ECG through the application. And then that information is transmitted to us, the clinician. And what we do is we provide screening for that patient or consumer that notifies them whether or not there is a potential problem with that rhythm, and gives them an idea of how quickly they need follow-up. And more importantly, we have a solution for them to find a physician in their area that's capable of taking care of that arrhythmia. So meaning finding a cardiologist or electrophysiologist that's in their area that can see them, that can take care of that problem. And so we developed the application, and then that's how ReadmyRhythm was born. The company is essentially a cloud-based software system that works off an application in consumer smartphones that takes that information from the wearable devices, transmit it to us, and then we provide the clinical triage, and then more importantly, find a caretaker, a physician, or a healthcare provider in their area that can address that problem. Currently, right now, without a whole lot of sort of effort to get the word out with the technology, we developed it, put it on the app stores, the Apple's commercial space and Google's commercial space for download. Without really any marketing, we have about 2,000 users, and we're getting about 150 users per day added to the platform. Again, this is all kind of word of mouth. With our plans in the immediate future is to scale this and launch marketing campaigns and approach not only the consumers, but we also feel that this is a huge value for corporations, for businesses, and to engage their employees in employee wellness. And so we're going to approach businesses to help them provide this software system for their employees so that they can provide essentially ECG health screening on a regular basis, essentially daily, weekly, monthly for all their employees. We think that's a huge asset to companies to provide them ways of making sure their employees are cared for correctly, and then routing them into efficient care. So meaning if they need to go to a physician, we can find them a physician without them having to go to the emergency room or an urgent care center. And so we think businesses will be very receptive to adopting this as part of their sort of health and wellness programs. And then also approaching insurers, insurance companies, underwriters to provide this service so that their subscribers, the people that are on their insurance plans, this service again will provide an efficient use of the technology that they already have, so the Apple Watches, and then get them into the healthcare system in an efficient and cost-effective way. And so our plans currently now are to scale with direct-to-consumer marketing, but also approaching businesses and healthcare providers. And the last thing is physician offices. And so again, when I said the problem started out of our own issue in clinical practice as a cardiologist, electrophysiologist, we think that bringing this technology to our other physician colleagues around the country will also provide a tremendous service. And so developing software that allow their patients in their practice to transmit this information to their practice easily, and then store that information in a HIPAA compliant way so that they have a way for their patients to transmit concerns and then have those concerns triaged. And then the practice gets notified if there's a particular problem. And so this is another service that we can provide for physician practices that will address our initial concern when we started all of this, is what to do with our patients that are transmitting these wearable device ECGs. This would provide an answer to that as well. Well, I think what it's going to do is allow the use of technology that's already pervasive. So a lot of people have already adopted wearable devices. Current statistics are there's about 200 million smartwatch users worldwide. The expectation is that's going to grow about 20% per year. And so we're going to have an extremely large population base that has this technology that's on their wrists, that's on that they have the capability at home. Even before they actually have a physician, they can record arrhythmias, diagnose problems without even having a physician. And what this technology is going to allow them to do is get into the healthcare system efficiently and find a physician in a care practice that can address that problem directly. And so it's going to avoid them having to suffer through going to the emergency room or an urgent care, or going through primary care and eventually finding a specialist. We can eliminate all of those middle people and get them quickly into the care that they need.
Thank you. So I guess the next step is kind of expanding this application and, as you mentioned, the marketing. But where do you see the future directions of ReadmyRhythm? Are there any, I don't know, applications that you are planning?
So I think what we're planning to do, fundamentally, what we provide essentially is triage as a service. So what we're going to do is start first with electrocardiograms and provide clinical screening for those wearable technology information that people have. But eventually, obviously, wearable technology is expanding to include all different kinds of healthcare information. So vital sign recording, sleep apnea issues. There's a whole host of applications that are being developed by these companies that can record health and wellness issues for consumers. What we think we can do is not only expand our platform with recording and providing triage for electrocardiograms, but we can provide similar services for all sorts of health information. Again, kind of leveraging the technology that now is becoming more and more pervasive that people are adopting, leveraging that technology and allowing the whole premise is allowing that information, that healthcare data, to transmit into the healthcare system and be addressed by experts, and then bring them into the healthcare system efficiently and to see those experts, and thereby bypassing a lot of sort of needless resource expenditures. And so we can not only do this for the electrocardiogram, but potentially expand to all forms of healthcare information. But first, we're going to concentrate on the ECG. That's obviously in our wheelhouse as cardiologists. That information is readily accessible now. And so our first priority is to expand our user base through marketing, and again, through going to businesses and healthcare providers and physician offices and provide this as a service. I think this is the way of the future. I think that cardiac diagnostics and I think healthcare diagnostics are going to evolve into a wearable paradigm, meaning that most consumers, most patients that are consumers will adopt this technology, have already adopted this technology, and it behooves us as the healthcare industry to use this to our advantage. And that is exactly what ReadmyRhythm is doing. We are using this technology. We are agnostic, meaning we can take any platform, any technology that's adopted by a consumer or patient, and provide information that's valuable to those patients. And what we see in this area is this is the future of cardiac diagnostics. In the next 2 to 5 to 10 years, most of our information, at least from an initial assessment, is going to be obtained through these devices. And I think we need to develop ways to address this information, and that's where we're leading. That's where ReadmyRhythm is leading. We are the leading software system that does this, and I think this is the way forward for what we do, what I do in diagnosing heart arrhythmias.